for a possible.
When Donald Trump announced this.
Earlier this week, I met with the leaders of health insurance industry who have agreed to waive all co-payments for coronavirus treatments.
It just highlighted a particular confusion the U.S. faces as it deals with the pandemic. Alone among developed countries, the U.S.'s healthcare system isn't universal, but run by for-profit health insurance companies. Even after the Affordable Care Act, or Obamacare, was passed in 2010, 30 million remained without health coverage, and the number of underinsured, those whose out-of-pocket expenses for treatment is over 5% of their income, has risen 50% over the last 9 years to an estimated 44 million. In fact, when Donald Trump was speaking in early March, no insurance companies were covering treatment. Now Congress has forced them to cover testing, and some companies are covering treatment for a limited time. But it's a confusing patchwork for patients that leaves many unanswered questions.
Well, what if you test negative? Is your bill going to be higher? It's impossible to answer that question.
In addition, your coronavirus test is covered, but your visit to a physician may not be. If other COVID diagnostic tests are conducted, like a white blood cell count or a chest x-ray that aren't actual COVID-19 tests, they may not be covered. The millions with employer-supplied health insurance may face large out-of-pocket expenses. Even hospitals covered by insurance companies perform procedures not covered by insurance, and the list goes on. In the best of times, patients and doctors often don't know what's covered until the bill eventually arrives.
My greatest sadness as a physician is that I often don't have the answer to that question. When someone asks me, how much is this medication going to cost? I often don't have the answer, especially with the added layers of a hospitalization.
The pandemic highlights another issue that was already a problem: prior authorizations. Insurance companies requiring doctors to prove that treatment is necessary, a process that can lead to delays of 1 to 3 days in freeing up hospital beds, crucial time during a pandemic. A recent American Medical Association survey found the process led to death or disability in 30% of cases, and that was before the coronavirus.
A prior authorization is a question to the clinical team of saying, are you sure? And we don't trust you. It seems a little inappropriate for quick, efficient, and compassionate care.
Such practices have contributed to insurance companies' massive profits since Obamacare was passed. And now, according to former health insurance executive turned whistleblower Wendell Potter, the industry is expecting to clean up as a result of the coronavirus.
They're seeing this as a possible opportunity for them to actually make more money. And to have a net savings, if you will. In fact, some of the CEOs have even told Wall Street financial analysts that they're expecting that because hospitals and doctors are canceling a lot of routine care. Also, the executives are saying to Wall Street that if we have to spend more money than we had anticipated this year, we will just raise rates for everybody next year. That's what they do. And they can get away with it because there's no other game in town.
It's a tremendous challenge.
This global pandemic has some specifically local characteristics here in the U.S. Shihab, Rattansi, Al Jazeera, Washington.